So welcome. My name is Kate Wilde and I am one of the co-directors for HDR UK Scotland. And today we've got a joint event with Research Data Scotland to hear about their Researcher Access Service. They're going to take us through it. So we're going to have Suhail take us through the Research Access Service. We've then got Adam, who's going to provide a little demo for us. And then we've got Matthew, who is going to take us through his application experience and where he is at with his research progress update. So it's a packed agenda. We will try and keep to time as much as possible. Like I say, there will be a chance to ask questions at the end, either using the chat function, and what we'll do is if you do put questions in the chat function, we will also respond to them verbally, but we'll type the answers in so that you've got that information for afterwards. And any that we don't get through today, we will take away and provide an update afterwards. So I think without any further ado, I'm going to hand over to Suhail to kick us off with the overview of the Research Access Service.
Excellent. So welcome everyone. My name is Suhail Iqbal. I'm the service owner for the Researcher Access Service. So I was going to give a little overview of what the service is, a bit about the foundings of it, the principles we've used to develop it, what you can expect in your user journey, some of the data that's available, and something about the next steps. Okay, so firstly, just to say a bit of what the Researcher Access Service is. And its guiding principle is to make things faster and simpler to access data, to support research in the public good. And of course, to do that, we do that lawfully, securely, in a way that really serves the users and has a very strong user focus. Okay, so a bit more about why the Research Access Service was needed. There's been a long-standing recognition that there's lots of different ways to access data, and it's not always clear how to go about this, where to go, who to speak to. It's a recognition that researchers sometimes feel that from pill to post to get access, and it just takes too long as well. So these are the things we were trying to address with the Researcher Access Service. We want to make sure that we can support research in the public good. So a little bit about our approach. So very much an agile approach for this, delivering value as early as possible. So starting small, testing, learning from our users. The users are at the heart of everything we do. And of course, close ties with the very excellent Idris team from Public Health Scotland, who helped develop this service. And it's been guided by user needs, lots of engagement with researchers and the public to make sure this is fit for purpose and delivers. Okay, so how does the Researcher Access Service work? Essentially, there's a digital inquiry form. So all you have to do as a researcher is visit the RDS, Research Data Scotland website, navigate to the eligibility inquiry form, and there put your requirements in, and then everything's taken care of at the back end through the excellent Idris team, who will look at your requirements and point you to the appropriate pathway for your research request, whether that's the Researcher Access Service approval pathway, or whether that is the Public Benefit and Privacy Panel approval pathway. Okay, so what makes a research request suitable for the Researcher Access Service approval pathway? So the Researcher Access Service uses the 5 saves framework. So having approved researcher status, your project, your research serves the public good. The data that you require is prepared from the Researcher Access Service datasets, and this will need to be accessed in a secure environment, which is Scottish National Safe Haven. And also there's not a requirement for you to identify any particular persons or make decisions about those people. So those are the 5 saves framework that underpin the eligibility. So I've put some links in this slide so you can navigate to the web pages and look in more detail what those eligibility criteria are. And also you'll find a link to the pricing menu for the service. Okay, so just some key features. So I already said something about the single entry point and the web page as your starting point. So there's a metadata catalog where you can find information about the data that's available. You can also find information about what information you need to supply as part of your application. So there's a lot of upfront information so you can start planning your application in advance of actually making your inquiry. But once you're ready to make your inquiry, there's a digital inquiry form, very short form, some questions to understand a bit more about your research idea, the data you require. And this goes to the Idris team in Public Health Scotland, who will make an assessment of feasibility, do a cost estimate, and based on your requirements, decide what is the appropriate approval pathway. So if the appropriate approval pathway for your request is the Researcher Access Service approval pathway, then you are directed to a digital application form. And this is really good innovation, because you're able to communicate with research coordinators in the Idris team, any questions that you have or things that are not clear, how to complete things on the form. You can just pop a comment in, and then one of the team will just respond to you, and you'll get the information you need to progress your application. And you can see where your application is in the overall user journey, in the overall process, what stage. So that's another another key improvement from the setup that went before. So you're not relying on sending emails to go back and forth to find out what's happened to your project. Okay, so the approval process is simplified. So projects under the Research Access Service don't need to go to the Health and Social Care Public Benefit and Privacy Panel. And so there's a simplified process there. And once a decision is made, then access will be granted in the National Safe Haven. And there you can request your outputs or amendments to your projects. Okay, so something about the data that's included in the Researcher Access Service. So these are the 9 key data sets that we find that researchers are most interested in. So you've got the health data sets here from Public Health Scotland, inpatient, outpatient, maternity data sets, mental health, the cancer registry, prescribing, accident, emergency, births and deaths registrations. So there's quite a lot of data there, which can serve a lot of different purposes in terms of the sort of cohorts you can build, the sort of designs that you can build for your projects. So a lot of versatility there, and quite a good time period also for any follow-up or look back that your study design might need. And again, full information about the variables within those data sets are on the web pages in the links. So be sure to have a look. Skip it on time. Okay, so just to say a bit about the journey so far, since we launched in April earlier this year. So as a single entry point, for all inquiries, we've had 126 inquiries. The bulk of these requests have gone to the Public Benefit and Privacy Panel pathway. So about 10% have come through to the Researcher Access Service pathway. And you can just see there from the data use register, 2 have already been approved and have access to the data. And you'll be hearing from one of our esteemed researchers later on. But the numbers don't tell the whole story. And as I said earlier, it's a very much agile, user-led, user-driven approach that we've used. So we're keen to learn from the users, yourselves really, and build on what is required. So some of the learnings we've had so far is that the user experience on the digital platform, a really welcome development, but at times it's been a little clunky in terms of the scaling on the screen for different devices. The ability to upload documents hasn't always worked as we've anticipated. So we're learning from that, and we're building in improvements to address those issues. The ability to contact research coordinators, this is really, really valued. This is what our users tell us, that it's important to be able to get insights and knowledge and guidance from the research coordinators. So although there is that facility to contact a research coordinator, there's certain improvements that could be made to it to make it a bit more user-friendly. And also the project tracking facility, it's a little basic at the moment. For example, if your project is in review, we don't have that same level of detail of letting the researcher know when it's actually gone to the panel versus when it's being reviewed by a research coordinator, for example. So there's some improvements that can be made on the tracking facility. And the guidance and information for researchers, again, in some areas, this is a little bit unclear. For example, guidance on what is required in your public goods statement. So again, we're looking at these areas to make improvements. So when your application goes to the panel, they have all the information they need to make that decision quickly. And one of the biggest ones would be the data sets that are available. So I said that these are the 9 most commonly requested data sets. So there is a lot of utility, a lot of research questions that could be addressed through this data alone, but we recognize that it's not enough for some of the insights that are needed to address some society's issues and sort of things that require linkage between health and non-health data sets, so cross-sector linkages. So that's a key limitation at the moment, but we're looking to address that also. And the final one, it's just that the data provision element is still a very resource intensive activity. And of course, if it's resource intensive and complex, then this adds to the time it takes to provide access to data. So this is another area that we're looking at. Okay, so then just to conclude really about what's next for the Researcher Access Service. So the main thing we want to do is, based on that learning, based on what users are telling us, is expand the types of data that are available so we can get the insights from cross-sectoral data. So that is a big thing that we're thinking about and working towards. So it'll be really important. I think my colleagues will be putting a poll or a questionnaire into the chat just to find out what data you think is needed to address society's issues, so we can start looking at those data to try and bring those in. So please, yes, tell us what your data needs are. Simplifying the data provision, again, as I said earlier, the data provision element is still quite complex. So we're looking at simplifying that so that once you've got your decision from the approval panel, then the data can be supplied very quickly soon after that. And the digital journey, again, we're always making improvements, and we've got a very good team in Research Data Scotland who are looking at the user needs and looking at the feedback, any bugs that arise, looking to fix those as soon as we possibly can. So that will be part of the next steps. It's just a continuing journey, really. And then just to finish off, just to be able to show the impact of research and enhance transparency. So we've got a very basic data use register, which I showed a screenshot of. So looking how we build that out, what other information the public really want to see and how they are involved in the service to enhance, because that's really important. All this work is through the public license. So it's really important that we address those.
Thank you. That was great, Suhail. So just a reminder, you can put some questions and answers into the question and answer box if you've got questions, and we'll go to them in a bit. And there is a live poll for you to answer Suhail's question on what additional data sets you'd like to see brought into the Research Access Service in future. So now we'll move across to Adam for the demo.
Thanks, Katie. Thanks, Suhail. Okay, so yeah, hi everyone. I'm Adam Coulson, Delivery Manager at Research Data Scotland. So I'm part of the team who co-designed the service with Idris in Public Health Scotland, and I'm product owner for the continuous development of the service. So yeah, as Suhail described, there's lots of work underway to talk to our users, to talk to researchers and the back-end users of the service, to understand how it's been used in anger, and try and improve it as we go. So I'm just going to share some slides. So I'm just going to talk you through the process that the Research Access Service takes a researcher through. So I'm going to talk about the initial inquiry. I'm going to see a video walkthrough of that and point out a few of the key elements. I'm going to show you the back-end system itself. So from a researcher's perspective, what they see when they log in and they complete their application. Show you a couple of the features during that stage, and also once the project's been approved, a couple of the features that happen towards the end of the process as well. So where do we start? So the user journey itself, from this perspective, would start on the the Research Data Scotland website. So what you can see on screen here is a screenshot of the homepage of the website and the accessing data section, the first navigation option at the top of the screen. And in there, you get access to an overview of the data access process, a checklist to look at before you begin an application, to try and communicate all of the things that are required as part of that process. And begin an inquiry is where you will go to have a look at some high-level eligibility questions. So this is just a short set of questions to make sure that what you need from us, we're able to provide. So to confirm that the Idris team and ourselves can assist you with your inquiry. So I'm going to try and play this video and let's see how we go. Sometimes works and it sometimes doesn't. But what I've got is it's just a quick step through that my colleague Vicky put together of the inquiry form itself. But we also have a downloadable version of this that we can share after the presentation as well. I should say a read-through downloadable version of the form, not just the video itself. So the aim of the inquiry form really is to understand the feasibility of the project from an Idris perspective. Is it feasible? Can we provide the data that you need and provide a cost estimate for that project? So you can see the form being completed here in the various fields that are included. And what we do here is we're really focused on only asking the questions that we absolutely need to determine a decision about the pathway that the project should go through next. So we ask various different questions here around the data sets that you need, your institutional affiliation. That's important to understand which organization you're applying on behalf of or connected to. We look for an overview of the project and trying to understand where you want to access the data. So on screen here, you can see, do you require to access the National Safe Haven to conduct your analysis? So it's absolutely crucial that that's the route, because that's the only place that we can provide the data as part of the Research Access Service. And we ask for some information about funding as well. So we want to understand the funding body and the end date of that funding as well, so to be sure that we can provide the data within that timescale. And so what you can see here on screen just now is the inquiry form has been completed. It doesn't take long. Feel free to go on the website and have a look at that in your own time as well. It's deliberately as short as it can be to just gather the basic information that we need to make that decision. And what we do is we show a cost estimate on screen there, which you can see. Based on a few of the answers, we're able to show that to help researchers who are looking to get a cost estimate to then go away and seek funding for their project. So all that information comes in, and one of the research coordinators in Idris will take this into what we call the triage stage, where decisions made based on information as to whether to direct that to the public benefit and privacy panels, or if it's suitable to come into the Researcher Access Service. And then a researcher will be notified of the next steps they need to take by email, regardless of which of those pathways it goes through. So the next step is we're working on the assumption that the project is suitable for the Researcher Access Service. It's good news. We want to invite the researcher in to the service to begin completing their application. And so they'll have received an email to log in. And what you see on screen here is the dashboard, which is populated with one application, which you can see there. It's all dummy information, but this is what the researcher would see when they log in. They've got their project, and you can see the applicant name, the progress. So there's 5 stages indicated by iconography there to indicate at what stage of the process they are. So the first stage there being the inquiry that's been completed, and the green icon, the secondary one, means it's in application stage now. And so the researcher can log back in at any time to see at which stage they're at, and any tasks that they need to complete to move it forward. And there's also some links to resources there as well, that we're continually looking to improve. So next, I'll just step you through a few of the screens in the application itself. So you might notice that the application form sections, which you can see at the left there in green, it's structured around the 5 safes. So you'll notice the language we've chosen there around safe people, safe projects, safe data, safe settings, safe outputs is deliberately designed to kind of replicate that language. And what we asked for here in the first section, safe people and organization, is what you would expect to some extent. It's your details that we need to process the application. And we ask about your research team, anyone else who you need access to the data in the safe haven, and any information governance training that they might have. We also ask for accredited researcher numbers if you are accredited. And what you'll notice on the right of the screen is the comments feature that Suhail touched on before. So we were really keen when we were building the service that we provided a way to communicate with the Idris team. And so this is the kind of current version of that, which is comments. So the comments feature is tied to each section of the form. So if you need a quick answer, if one of the questions is unclear, maybe you're not quite sure what you need to provide, you're able to leave a comment on page, and that will ping into the team, who will be able to get back to you with an answer for that question. And that's present throughout the entire application form. So under Safe Project, what's interesting here is that we pull through the description you've already provided in the inquiry form. So we obviously we want to avoid rekeying information as best as we can. So we pull that description through, and we also ask for a few elements around research questions, and also estimated duration of your project as well to enhance that. And then the next element is quite crucial to the sign-off, so that the approval within the panel is we're looking for a statement of public good. And so this is something that Suhail touched on. We're trying to improve the guidance content that we provide here, because how this is written and what this includes is one of the key parts of the approval with the panel. So what we're trying to encourage people to make this as full as possible, and we're also now linking into the data use register that Suhail showed on screen, because we want to be able to expose the statements of public good that have been approved through the panel already, to help people understand the kind of quality of those statements that need to be provided. And then under safe data, again, this is where we ask for more information about the study population that you provided earlier on, any linked data, and the answers that have been provided earlier on. You can go in and edit those, of course. We just pull that through as it stands, but that can be changed throughout. And then under the safe settings section, we reinforce that message that the data is only accessible in the Scottish National Safe Haven, and that each member of the research team needs a user account for that, and therefore needs to sign a user agreement. So this is really just a confirmatory message to reinforce that. But if any projects require access to data in a different location, they wouldn't have got this far. They would have been taken out of the process so far and gone to a public benefit and privacy panel. So this is just a reminder of that criteria. So the next screen you can see here is around the safe outputs. So this is where we ask for a bit more information about the publications and dissemination that you're going to do with your research. and another confirmatory message to state that only outputs undergoing statistical disclosure control will be released from the safe haven. So that's just to ensure that no requirements are part of the project which might lead to any unintended disclosure. And then finally, we ask around funding. So we've already asked for the funding body, but we also looked for funding end date to make sure that the project can be supplied in that period as well. So that's the very quick step through of the application form. So we know it's not necessarily quick. There's a lot of information to be gathered, but you can obviously save and exit that at any time and come back once you've got more information throughout the process. And so let's just make a bit of a leap here and assume that that project's been submitted and it's been approved, and the researchers now have access to the data in the safe haven and they're conducting their analysis. What you can see on screen here is the two options available to the researchers at that stage, which are to raise a query or raise an amendment. So raise a query is essentially the mechanism through which a researcher can raise some of the common questions that tend to come up at this point. So this could be issues with access to the National Safe Haven itself. Those can be handled through the Idris team too. It could be issues with the data that they've found in the safe haven. It might not match up to their expectations, so that could kick off a conversation there. This is also where output requests are handled as well, and any other queries that might come up. So the queries are around kind of a customer service element fundamentally, but amendments are slightly different. They're kind of changes to the scope of the project that's been approved. So there's 4 types of amendments built into the service as it stands, but we're looking to develop this as we get more projects through. So currently, some of the common things that tend to come up is researchers want to add another researcher into their team, so they can do that through this flow. You can add the details of that person and that'll go through to the approval panel. You can extend the study end date, which is another common one. You can request additional data or add other research questions. So these are the common things that come up, and some of them require approval through the panel, but some of them can be approved within the research team themselves. And some of them have a cost implication as well, because of the kind of administrative burden that's required to complete those requests. So that's just to show you what can happen at that stage of the process too. So that's a whistle-stop tour. So we're obviously continuing to develop and improve the service, and Suhail touched on the kind of user-centered design approach that we're taking. We're listening to our users. We're trying to engage with as many people as possible to get feedback, to find out what's working and what's not. And we know there's lots of things that we can improve on, and we're actually doing some work with our developers at the moment for a next release in early next year, hoping for January next year. So yeah, any questions in the chat and in the Q&A? I can see there's a few in there just now, so hopefully that's been useful to give people a sense of the service itself.
Perfect, thank you very much, Adam. I'll hand across now to Matthew, that's going to tell us about his research project and the application experience.
Yeah, a second. Hopefully everybody can see those slides okay.
Perfect, yeah.
Yeah, hi everyone. So I'm Matthew Iveson. I'm a researcher at Edinburgh University. I'm talking today a bit about my experiences with the RAS. I was one of the first ones through the kind of application process and the portal, and I have a project that's currently live in the Safe Haven as a result of it. So I'm going to be talking a bit about kind of the things that I noticed along the way, maybe some tips and tricks, and yeah, happy to answer any questions that you guys might have. So firstly, a little bit of background. I'm a researcher who's primarily interested in the life course determinants of depression. I use electronic health records, and I have done for the last 6 years, mostly looking at, again, depression and mental health, but other things as well, like dementia. And primarily, in the past, I've used the PBPP access route, so spending a long time going through the approvals, waiting for data to be provisioned and then sitting in a safe haven, as some people might be familiar with. But the RAS project that I pitched for this was trying to look at people with severe mental illness. So that's people identified with things like severe depression, bipolar, schizophrenia, through hospital admission records, and looking at how they've been prescribed antidepressants over their kind of lifespan, and whether there are any consequences for particular patterns of antidepressant prescribing in terms of their healthcare utilization or mortality risk. And so it kind of used specific data sets that were included in the 9 RAS data sets reasonably nicely, and so hence why it fit for the RAS procedure. A little bit about the timeline. So I submitted my inquiry form kind of at the end of March. It took a few days for that to come back and say, you're invited to submit a full application. I spent a bit of time drafting an application, roughly about a month. Really helpfully during that process was a lot of comments from the Idris team about particular sections that weren't particularly clear, or particular documents I hadn't filled in appropriately. And so after doing a little bit of tweaking and a bit of redrafting, submitted the full application on the 2nd of May. And that went out for review. The review was notably much faster than if anybody's used the review process for things like PPPP. And after the review, it was approved, fantastic, with a few minor tweaks. And then the rest of the time was spent trying to nail down the data specification with Idris staff. Basically, things like what was the control sample like, what is the exact exclusion criteria, things like that. So all in all, about 3 months, which again is very fast compared to other access services. So yeah, believe the hype, I guess. My experiences, so there were some very easy things. The portal is lovely. It's much more kind of user-friendly than your kind of traditional Word document PPPP sort of form. As has been mentioned a few times, the comment feature I think was definitely the most helpful. Being able to get responses within 1 or 2 days about specific bits of the form I think was really good. And yeah, typically responses for the comments were fast and useful. So yeah, it was very good. The format of the form, although it's kind of structured in the 5 safe sort of way, it's also fairly similar to the structure of other forms if you've ever used any other kind of big data repositories. So kind of figuring out what they were trying to ask wasn't too difficult for me, but I guess if it's your first time applying for sort of big health data, then you might need a bit more time to go through the questions one by one. In terms of the hard things, Suhail mentioned that the UI was a little bit clunky. I know improvements are being made and have been made. It was just lots of little things, like I'll mention a few of them in a second. Things like sizing and trying to paste things into a text box and things like that. And although there are 9 data sets, I'm sure everybody wants more. I would have loved more as well for future. So I guess bear that in mind, that if you want anything more than the 9, then yeah, you're going through PPPP. But I guess the bigger question would be, would I be a repeat customer? And the answer is yes. It seems like a very good service if that's kind of, if all of the data that you want is there, then I think it's a very good route of access. Specific kind of recommendations. One is to try and prepare as many documents as you can in advance of the actual application form being kind of made accessible to you. So there are things like the data privacy impact assessment that are pretty standard for every sort of big data project. These are the kind of things that you'll run through your data protection officer if you have one in your organization. Also be ready with evidence for your information governance training and any ethical approvals that you have. So just have all those documentation bits and pieces ready to go once the application arrives. And it's worth thinking about things like which lawful basis of processing are you going through, which sort of legal gateways are you using, which have a very good data specification ready beforehand. I think this was why we had such a long time talking with Idris after the application was approved, was just that maybe I wasn't very clear in the way that I'd specified data in the first place. And so having that really crystal clear, I think, is going to be useful for anybody looking for a very short turnaround. Also, be aware that the National Safe Haven is a very secure computing environment. There's lots of good websites and documents about how to use the Safe Haven, but just be aware of some of the things that you might need from the Safe Haven when it gets set up for you. If there's any additional software you need, if there's any kind of additional bits of code or kind of phenotypes or that sort of thing, definitions that you might want added on there, because that's good to let them know in advance, and then it can be ready for when you start. In terms of practicalities, yeah, I mentioned a few kind of UI sort of niggles. One was that the scaling of the web page is not the best, so don't try and do it on your mobile phone because it won't be very kind to you. I found it was pretty helpful to have two screens so that I had the application up on one screen and then I had everything else on the other one, rather than trying to make it half screen or windowed or anything, because then it just the actual questions and then the text box kind of scaled weirdly. Also, remember that access to health data under this route is kind of restricted to the UK. We had a little bit of an issue where a master student really wanted to use it, but they weren't based in the UK and therefore just couldn't do it, which is something to be aware of when you're going into it. Also, it is still, I mean, 3 months is still a reasonable amount of time for anybody who's trying to get funding for this sort of thing or commit time to it. So allow time to finesse the application, so not just shove stuff in, but trying to make things read nicely, especially given that it's going to be presented to a lay audience. Give time to discuss and finalize the data specification with the Idris staff, especially the people who are doing the extracts of the data, because if things aren't clear and you end up with the wrong data, then that's more of a time waste than you need. And also be aware that anything in the Safe Haven, anything that comes out of the Safe Haven needs to be disclosure control checked, and that takes time too. Not very long, but if you have a deadline for something like a conference presentation, then don't do it the day before, because it just won't happen. I was asked to mention briefly about the public benefit statement. There are a list of kind of checkboxes, statements that you need to endorse. So have a think about which ones are applicable to your particular project. So for mine, it was things like helping to understand health needs, and better understanding for preventions. And then there's a section that's a lay statement for how your project is going to meet these kind of endorsements. And it's worth thinking about things like how your project's going to improve the health of patients or improve the service provision provided by the NHS. And also how your research will benefit other stakeholders beyond patients and the NHS too. So for example, if you're going to produce tools that will help other researchers in the future who are doing the same sort of thing. Some useful resources, I've included some QR codes things I found useful. One was the Research Data Scotland metadata catalogue, but also the Public Health Scotland data catalogue, which has the kind of national data and gives a bit more context about how some of the data sets are made in the first place. HDR UK phenotype library is good if you're looking for definitions of things like severe mental illness. There's a nice list of codes that could be included in those sorts of things. Information governance, there's a good MRC online course, which is kind of acceptable by most people. And in terms of getting a sense of public benefits, it's worth looking at the James Lind Alliance research priorities, because if you can say that your study aligns with some of the priorities that have been set by patients themselves, then that's usually a good first step. Quickly, progress to date is mostly descriptive. I've been looking at how many people are in the cases and controls and starting to look at some of the patterns of antidepressant prescribing that they seem to experience, and from then it'll be on to some of the inferential stuff. But needless to say, getting this far has been quite exciting. Hopes for the future, more data would be great. Everybody probably agrees with that. Particularly for me, it's hoping to get prescribing dosage information, which is available from Public Health Scotland and the prescribing information team, but is not currently in the RAS. Also, things like environmental data, I think, is extremely interesting, but isn't part of RAS yet. And also improvements to the user experience, which, is ongoing. In particular, Suhail mentioned having updates when things move beyond the submission process. So when they're being reviewed, that will be useful, so it doesn't just kind of disappear into the ether. Having some sort of community space for projects that have gone through the RAS, like wiki pages and GitHub pages that can help make things easier for other RAS users, I think would be quite useful too. And that's it. Thanks very much.
Perfect. Thank you very much, Matthew. So it's now time for questions and answers. So if I can ask our presenters to come back onto the screen. The first question was, is it possible to download a Word or similar version of the form so that people can work through it with colleagues before completing the online application? You want to take that one, Adam?
Yeah, of course. Yeah. So on the website, we have a link to both a read-only version of the inquiry form and a read-only version of the full application form. So we can follow up with those links afterwards, and they're a part of the kind of user guidance content on the website. Yeah.
Okay, next question comes from Andrea. So are there any plans to support generation of synthetic data? Is that in RAS, from RAS?
I think that's my question.
Okay.
Yes, so absolutely is. It's not something we've done much of yet, but it's an opportunity for us to tell you how we are making available NRS census data as part of our metadata catalogue, and hopefully that will go live next week. And we're going to be following that up with our ADR data sets, hopefully in the new year. And once we've done all that, we're looking at ways of making, going to be working on how can we make the RAS, the Researcher Access Service data sets available, whether we do it in the same way as our ADR data sets, or maybe look at different ways to do that. But it's definitely something on our agenda, something we're going to be looking at in the new year.
I would just like to say a big thank you to our speakers today, so Suhail, Adam and Matthew, to the RDS team, Emma and Co, for arranging this and getting this set up. We hope that it has been useful. There doesn't seem to be any more questions, so I'm going to give you a whole 6 minutes back to go get that cup of coffee, cup of tea before your next meeting. So once again, thank you very much for joining us, and we look forward to seeing you soon at another event. Thank you all.